Nedza, ambulance manager here at Waverly Health Center. I don't know about you, but if you see an ambulance driving with lights and sirens, your heart might skip a beat. Someone else's heart might be skipping a beat, which is why we're going to respond to their call. However, there's a lot of times where lights and sirens use really is not effective or necessary. EMS as a whole is starting to understand why it's dangerous. For us in EMS, it's only been shown to save about 1.5 to 2 minutes, which might seem like a lot of time. However, most emergencies, while still an emergency, are not that time critical. And so what is an unsafe practice is for us to run lights and sirens when the time savings really is not effective or beneficial to the patient. It puts us at risk, puts the people driving the cars at risk as well. So in addition to the staff, the public, also when we're transporting the patient with lights and sirens, there is an additional physiological response in patients that can worsen their condition. So the light that's might be flashing, that may cause some issues. Just increased heart rate from the siren sound, that already is making a sick person potentially even more sick. So we're trying to create an environment where we're transporting the patient in calm ways. That way it helps them. As we learn that there are a lot of risks potentially with the running lights and sirens, the National Association of EMS Physicians has stated that we really need to justify the use of lights and sirens use. It's like a treatment. If we're going to do something that is going to potentially cause some harm with the patient, we need to be able to justify why it is that we're doing that. But the time-sensitive things, if somebody's in cardiac arrest or a bad trauma. And so those are the times when, those seconds, those extra couple seconds really do make a difference. Driving with lights and sirens for those in the ambulance is a risk as well. We don't always know, and oftentimes having driven an ambulance with lights and sirens, people don't seem to know what to do. And so it causes more accidents potentially for us driving the ambulance. And if we're not able to get there because we're in an accident, then we can't help that person we were going for anyway. Also, a lot of times, like I said, people just forget what to do. They panic, which makes sense. We catch them off guard. They're not quite sure exactly where they're supposed to go. So they may stop in the middle of the roadway. They may go to the left. They may try to speed up and go around other people who are already stopped. And so it just creates a moment of chaos on the roads. And so when you're sitting in the ambulance driving, you really do get to see that. So if you do have lights and sirens coming up behind you, whether it be an ambulance, a police car, fire truck, remember, just pull to the side, to the right side of the road when it's safe. Put your blinker on and make sure everyone knows that you're turning it, you're getting off to the side. If you do see that we are stopped on the side of the road, usually we're going to be on the right side of the road at a car accident or whatever the situation is, and we will turn our lights on. If that's the case, then just remember to give us plenty of space, go around us to the left, and slow down as much as you can, because we will be getting stuff out of the ambulance. We'll be loading the patient, unloading some of our equipment, and so we do need as much space as we can. So again, just for everyone's safety, driving, that way you're not causing an additional accident that we'll need more resources for. So that moment I talked about, when you see lights and sirens coming up behind you, that moment of panic, right? That's your adrenaline, that's your response, that flight or fight response in you. And so keep in mind that that's very momentary for you. For us driving the ambulance, that lights and sirens use, that's sustained for the entire time that we are responding. It gets our heart rates going, whether we're a seasoned paramedic, a brand new paramedic, whatever it is. And so for us, it's just, again, some added stress that's not necessary, especially when we're showing the time savings isn't really there for the patient as well. So not only is there the stress for the patients, but then there's also some harmful effects for the responders as well. As I mentioned, studies are out there now that are showing limited lights and sirens use as a positive thing. The ambulances now are such an extension of an emergency department that very little of the care that's provided in an emergency department is not already happening in an ambulance. And so that's why transporting patients with lights and sirens really is not that useful anyway. A lot of that's life sustaining. The stabilization is happening in this ambulance just like it would in the emergency department. So what can you do? Well, like I said, if you do see lights and sirens coming up behind you, make sure that you safely pull off to the side of the road, on the right side of the road. Wait for the ambulance or whatever to pass. Make sure that there's not a second vehicle coming as well, because oftentimes, especially a car accident, there's going to be a fire, there's going to be police and an ambulance responding, maybe two ambulances. So make sure before you pull back into the roadway that there's not a second vehicle coming as well. So that's what you can do. The other thing too, like I said, with the time savings, the CPR, knowing how to use an AED, basic first aid, that's really what's going to save people's lives. Because even if you have a bad laceration, for example, it's way better and more effective for you to use a tourniquet. We're not going to be able to get there right away to put that tourniquet on. So that's another reason why those basic first aid skills are extremely important. It helps us. So really, you're the first responder in that situation. If you have any questions, you want to know how to do that, you want to know how to do CPR, how to use an AED, where can you find an AED, reach out to me, reach out to any of us here at the health center. We'll be happy to help you, provide an education class for you, whatever it is that you need. Thank you very much for your time. I appreciate it. If you have any questions, like I said, feel free to reach out.